A patient asks me, I'm interested in having lip filler injections as I've always been unhappy with the thinness of my lips. However, my concern is that I feel I have a very small mouth in comparison to my face. Will getting lip fillers make my mouth appear bigger or more in proportion to my face, or would it just not work at all with the natural shape of my mouth? Do you have thin lips and a small mouth and wondered whether you can get the same results from lip fillers as some of your friends? Have you been concerned that you may not have the lip structure, or possibly think it may be more dangerous or painful because your lips are naturally thin? Well, do not worry. It is all about the choice of filler and the skills of your clinician, because in the right hands, you can get fantastic results. This video is to answer questions that may be of a worry to you and hopefully offer some insight into your very first lip filler injections. Over the last year, I've had increasing numbers of patients coming to see me, and they have thin lips and small mouth. All of them ask me the same questions, and invariably, they had a similar image in their minds of the desired outcome they wished to achieve. What is imperative to mention is that lips are the second most noted feature on your face, second to your eyes. They play a very important role in facial symmetry and the perception of facial beauty. Many people are of the perception that your lips are some of the most emotionally expressive features of your face. The above said, the definition of the perfect lips vary between ethnicity, culture, age, and current fashion trends. In my experience, the small thin lips are by far the most difficult to inject and mold. However, this does not mean that the results are likely going to be undesirable. Quite often, people with small thin lips get the best noticeable results. The biggest misconception I see in my practice when it comes to small thin lips is that one treatment session is all you need and that you will walk out of the clinic with luscious, voluminous, and sensuous lips. Unfortunately, this is not the case. In my practice, I've always supported and encouraged my patients with small thin lips to take a more gradual approach. Due to the nature of lip filler injections and the delicate anatomy of small thin lips, there are more risks involved if you are too ambitious with the amount of filler to be injected in just one session. Everyone's anatomy differs. For those with thin lips, the blood vessel network is located more superficial, closer to the surface of your lip mucosa. This means the procedure is more likely to cause bruising. Someone whose mouth is small and lips are thin, the skin of the lips are more taut. When injecting lip fillers in a small confined space with smaller surface area, the skin overlying the lips can be stretched more as they have less give. Again, this is why I advocate a more gradual approach, preferably over 2 treatment sessions. Gradual build-up allows the skin of your lips to stretch and adapt with minimal swelling and discomfort. The choice of filler is an important factor too. Clinics which charge very little for lip enhancement with filler often use a type of filler which focuses on volume. This type of filler tends to be quite hard or stiff, and when injected into small, thin lips, especially in large quantity, can cause inappropriate stretching of the lip mucosa. So how much filler do you need? This varies from patient to patient. Each patient's facial anatomy is different, and And it is only when I examine your face in person that I can determine how much and the type of filler I will use. It is important that we assess your face in its entirety because the ultimate size, shape, and height of your lips must be in proportion with the rest of your facial features to ensure that your lips do not stand out like a sore thumb, thereby attracting unnecessary attention to them. The above said, I do not promote more than what's required in one setting. While this may work out slightly more expensive for you, it is the right way to approach this treatment. One of my patients asked me if she would feel more pain during the treatment because she has thin lips and a small mouth. While everyone has a different pain threshold, my lip filler injections are known to be virtually painless. I have honed my skills over the years and I know all the tricks and secrets of injecting in the least uncomfortable way. You will be surprised that neither numbing cream nor local anesthetic injections are needed. I know this sounds too good to be true, but that is the truth. Lip enhancement treatment with soft tissue filler should be exciting, and you should not have to worry about the discomfort and pain, even if you have small, thin lips. Will it look too obvious and too big, you ask? Not at all. This is why it is imperative that we always consider your face in its entirety to make sure that the eventual result is proportionate to the rest of your face. One mistake many people make is that they zoom all the way in to just the lips and they forget that the lips are a part of the face. It is also one of the reasons why I advocate a more gradual, stepwise approach, because it gives us better control over the result and ensures that the final effect is not a result which is talked about in the wrong context. I hope the above gives you some insight into the ins and outs of lip filler injections for someone who has thin lips and a small mouth. For more information, visit our website. The link can be found in the description box.